it's Janine. Wanted to give a little update and a little video on massaging, what I've done so far for after post-op massaging. It is now almost 4 weeks, or 3.5 weeks, I guess. I had my 3-week post-op. Today's Saturday. I had my 3-week post-op on Tuesday. Yeah, I think it was Tuesday or Wednesday. And then I had physical therapy yesterday. And I got the okay to do some more light massaging, that sort of thing with physical therapy, but I can't use the Therabite, and I can't do any heavy, real heavy massaging or anything like that. I'm still on a no-chew diet. But when I was at the physical therapist yesterday, she was like, yeah, everything's feeling really good, and it's, a lot of stuff was moving. Some things weren't moving as much. So I wanted to kind of go over what I've done. Of course, check with your surgeon what they want you to do, what they don't want you to do, those sort of things, because I don't want you to go by this and then hurt yourself. So check with them, and remember everything being real light. So first, I want to explain, and you can look it up and get more in depth. But under your skin, you have fascia and then the muscle. And if you look at a chicken breast that you get from the store, the fascia is like that white, really thin white membrane almost over the muscle, over the meat, and under the skin, and it should move. When you're really tight, and when that dries up and gets hard, then that's when you start having a little bit of problem. Or with scars, scar tissue will start to form, and it starts to all adhere together, and it's like glue and sticks all together. That's kind of the best way I think I can explain it. So when at my 1 week post-op, I was given the okay to do some light massaging, not on the scars, not to do anything with them, but just light massaging and movement. So that is what I did. Now, I have a history. When I was 17, I became a licensed cosmetologist. I did that for quite a few years. And then I became a licensed massage therapist, and I did that for a few years. I couldn't do that as long because I had done so much clerical, and I had tendonitis in my wrists. I had problems doing that during the massage therapy, me giving massages. So it was too hard on my body. But I do have a background. I don't by any means claim to know, that was quite some time ago. I don't know everything. There's been a lot of, advancements since, and I just go by what I feel and what I know, or what I think I know. And as I told my physical therapist, I know enough to get myself in trouble. So I'm going to get you guys in trouble. So basically, when right after the surgery, these scars, I have a scar right here, and then I have a scar here. But this scar, I don't know if you can see that scar there. These areas were real tender and tight, and it was real tight. Like when I would move my head from side to side, you could just see that it was super tight. I don't know if I showed it in some of my past videos, but it was super, super tight. he didn't want me working on these, I would just lightly just trace my finger right underneath them. So I would just lightly go right above them and right below them. And then at times I would just, scar is right between my two fingers, and I would just go lightly back and forth. Just to kind of, because it did feel good, and to kind of loosen that up so it wasn't quite so tight and held down. And then I just, as much as I could do at the time, I'd stretch a little bit, look. And I would just stretch back and forth, just real lightly. So if you're just post-op, it will be really tight. You might just be able to go right here. You might not be able to go very far. But I would look up and I would consciously just drop my shoulders and relax. You know, kind of, okay, this, because it will go all the way down into your chest. So I just, you feel the stretch, just lightly. So I had done that. Now for the rest, because again I had a scar here, so you can just kind of walk along with your fingertips, whatever you feel like you can handle. And I just kind of go up and away. Those are a few of the things that I did just on my face, really light, really early. And then of course I would go around my eyebrows and up. So those are some light ones that I would do every day. A lot of times I like to do them in the morning when I was still laying in bed, kind of trying to relax. Also, just putting my hands on my face. And relaxing in just tiny little circles, just so you're moving. Now after my 2-week checkup with the first time I saw the physical therapist, she had given me some other little tips of things that I can do at that point, because we really didn't know how much I really needed or could do until after my 3-week post-op appointment. So in that time, this is kind of the routine. I kind of pinned my hair back so we could see what I'm doing, but I'll have to take them out. So in the morning, I would do around my eyebrows, and I'm just doing little circles, just tiny little circles. All the way to the temples. And I go into the hairline a little bit. So I'm above the scarring, and I'm getting just into that temporalis area. Which I did this before surgery too, because it just feels good. And so I would do the same thing, just pausing on any portions that I feel maybe aren't moving as well, or a little that I feel like I need a little bit more. And just going. It feels good just to Move everything up and out. And I'm a big time eye rubber, so this kind of helps keep me from digging in and really rubbing my eyes. I just, whatever reason, I like to do that. So I would my husband just got home. So here I'm just kind of doing little circles. And I'm going in, I'm going to take this one out. I'm going in to at the top of that scar even. Just lightly going around. Because you want to see even the skin around here, just tiny little circles, just moving the skin all around your ear. Your ear's supposed to move. So all around the ear. And I would do, my scar comes here, goes right in here. Let's see if you can see that. So now I actually go on the scar, just move that in little circles. I don't want to hurt anything. I don't want to feel pain. But tiny little circles. I'm going to go both ways. So go clockwise, go counterclockwise, and go slow. And then what I do is there's my cheekbone. And I just go all the way down. Even behind, there's my scars right here, right behind the ear. And then I started having some pain, tightness in here. So I make sure to move this a little bit all around here. And I'm getting some shooting pains on this side especially. So I move it around my chin. Hi, sorry about that. My husband came home and then I was really hot, so I changed my shirt. So, I think I left off doing the chin. And then another thing I do, and I was told to do right after the 1 week, was to smile, move my mouth, laugh. Now I have to tell you that laughing too much or crying right after surgery hurts. When you have the LeFort, when you have it up here, it hurts bad. So just take that slow. Take it slow. Do as much as you can. But there was one point that I started crying. I started laughing. Then it hurt so bad I started crying. And the more I cried, the more it hurt. And it was just a cycle. And I went into full-on like panic crying and not being able to catch my breath. And it was terrible. And then my husband's like, what do I do? What do I do? I'm like, go, just leave, go, go, go. Get out of here, let me calm, because I just needed to calm down and breathe to get to where I wasn't crying, I wasn't panicking anymore. So then just you know, your whole face. Sometimes it's just nice to kind of put and support, a little up pressure. It just kind of feels good. So moving that around. Remember, just little circles. Goes deeper is hard. That is comfortable without hurting. You don't want to cause any pain or anything like that. So a lot of that. And then in bed or in the shower, I was doing a lot of showers and washing my hair once or twice a day just to massage my scalp. So on the scalp, again, just circles all in the temporalis. You just get in there and go and move. And it's the same thing. You want your scalp. Can you see my scalp moving? That's just my scalp moving. Yeah. You want everything moving. So you just go through, move everything. Another thing that feels really good is taking a handful of hair and just doing hair pulls up. Sometimes the pulsing feels good. Now don't forget the crown up here on the very top. Even in the back, so I'm grabbing here from way in the back. And if you pull on that, you can feel the stretch down. You feel it coming down into your neck, and that's good. So you just do a lot of that nice self massaging, nice light stuff. And this is the stretch that she had me doing, and there's a couple things to it that I've noticed, because you know you're so guarded, you don't want pain, and but you're so guarded on the opening, and you quite don't know how to open or yawn or anything, because you've been doing it one way for so long. Like I always jetted my jaw to one side to kind of secure it when I yawned, or to suppress the yawn. Now it's a little different, and I'm having to learn all that stuff again. But this is one of the stretches she had me doing, right under the cheekbone where that muscle is. Open, and then just massage down, or just go down the muscle. So and when I'm doing it, you'll see me kind of, it looks like I'm breathing. I'm breathing in, I'm breathing out, just to kind of relax that, to relax into it, and let it just gently open. No, I'm not pulling on it. I'm just kind of a lighter, firm pressure. And just allowing it to come down even more. I think I'm getting past that, or trying to get past that barrier of, I need to stop, it's going to hurt, to, okay, just breathe through it and let it, relax it, don't guard it, just kind of let it go as long as it doesn't hurt. So that's what I'm doing right now, and we're going to be doing that for the next few weeks. She does massages, and she gets into other areas, and it's looking at more things. when my physical therapist, is doing it. So she's assessing as well as getting things moving, and we are still not able to do a lot of stretching, real stretching, like opening too wide, because when I open super wide, it's like I can feel the stretch in the very back of the roof of my mouth. It's almost like I can feel something going on, and we don't want to do anything to mess with the LeFort, with the upper palate yet. So those are the things that we are doing. I do have some, the side isn't working as well. I do have some side to side. A little less going to the right. Oh, and I make faces all the time. Stretch real big. And practice blowing on hot food or something. That was kind of weird at first, so moving to where I'm blowing up and down. See if I can whistle. I have been whistling every now and then. It actually comes out as a whistle. Not so much. So practicing whistling again. I have birds, so my birds love to hear me whistle, and we whistle back and forth and stuff. So that was something that I'm practicing of doing. Other than that, well, I hope this helps, and I'll be, in 3 more weeks, when I get the Therabite, I'll give some updates then on that sort of therapy and what that looks like. But for now, it's just gentle, moving stuff around, keeping things going, while smiling, and I puff my cheeks out. That feels good. I can use my electric toothbrush and a water pick, and I actually use the water pick on just a low, and I massage the inside of my cheeks too a little bit. I've been doing that for years, to kind of help keep as much as I can loosened up. But that's what I have been doing, and obviously just make sure that you these things with your physical therapist or your surgeon if you're doing any of these post-op. Make sure that he gives the okay with anything that you want to do, and you'll probably get that okay your first week after post-op. You can ask him about some of those. Again, just don't do anything that hurts or causes pain. Anything that doesn't feel right. If it doesn't feel right, don't do it. All right, well, have a good weekend. Bye.